Gentlemen, let's be real for a moment. If you're over 65 and dealing with high blood pressure, diabetes, or heart issues, you might think that enjoying intimacy like oral sex is off the table. But that's not true at all. In fact, according to the CDC, sexual activity remains important for emotional well-being in older adults, and with the right approach, it can be safe and satisfying. Hi, I'm Dr. Larrisa, a urologist with over 11 years of experience helping men just like you across the US reclaim their confidence and vitality in the bedroom. Today, we're diving into a topic that's often whispered about, but rarely discussed openly: how to safely enjoy oral sex when you have underlying conditions like hypertension, diabetes, or cardiovascular disease. I'll share practical tips backed by science from sources like the Mayo Clinic and the American Heart Association, plus real stories from my patients. No judgment here. This is about empowering you to live fully. And remember, this isn't medical advice. Always consult your doctor first. Before we jump in, hit that like button if this resonates, and comment below where you're watching from and your age, like Ohio, 70. It helps build our community of strong, informed men. Let's get started. Now, for the main part. I'll break this down into 7 key tips, covering the biology behind your conditions, emotional benefits, and practical steps to make oral sex enjoyable without risks. We'll tackle high blood pressure first, then diabetes, heart issues, and some general advice. Tip 1. Understand how high blood pressure affects oral sex. Biologically, hypertension can lead to erectile dysfunction or reduced blood flow, making things feel less responsive. A study from Harvard Medical School shows that 70% of men over 65 with high BP experience some ED. But oral sex is great because it focuses on pleasure without needing full erection. Emotionally, it reduces performance anxiety. One patient in Florida, 67, told me it brought back intimacy with his partner after years of worry. Practically monitor your BP before activity. If it's over 180/110, skip it and see your doc. Start slow with gentle stimulation to avoid spikes. Tip 2. Manage medications for better experiences. Many BP meds like beta blockers can dull sensation or cause dry mouth, which isn't ideal for oral activities. Per the American Urological Association, this affects up to 25% of users. Emotionally, knowing this normalizes it, you're not alone. Practically, talk to your doctor about timing. Take meds earlier in the day. Use saliva substitutes or hydrate. Well, a simple glass of water can make a big difference. One 72-year-old patient from Texas switched his med timing and reported feeling more engaged. Tip 3. Diabetes and nerve sensitivity. What to know. Diabetes can cause neuropathy, reducing sensation in sensitive areas, as noted in a Mayo Clinic report where 50% of diabetic men over 60 face this. But oral sex can heighten other senses, like touch and connection. Emotionally, it boosts self-esteem by focusing on giving and receiving pleasure mutually. Practically, control blood sugar pre-activity, aim for under 180 mg/dl. Use lubricants if dryness is an issue, and communicate with your partner about what feels good. A 69-year-old from California shared how this tip revived their spark without complications. Tip 4. Protecting your heart during intimacy. Heart disease means avoiding strain. Oral sex can involve positions that raise heart rate. The American Heart Association advises keeping activities moderate. A study showed sexual activity is like mild exercise for most. Emotionally, it fosters closeness, reducing stress, which benefits heart health overall. Practically, choose relaxed positions, like lying down, and pace yourself. Breathe deeply. Stop if you feel chest pain. Use pillows for support. I had a 75-year-old heart patient in New York who incorporated this and felt safer and more connected. Tip 5. Busting myths about risks. Many think oral sex is too risky with these conditions. Myth? Science from the National Institute on Aging shows moderate sexual activity can improve circulation and mood without harming health if managed. But truth: STIs are rising in seniors per CDC, so use protection like dental dams if needed. Emotionally, debunking this reduces shame. Practically, get regular checkups. Discuss with your partner openly. Tip 6. Communication and emotional prep. Biologically, stress from conditions can spike cortisol, worsening symptoms. Emotionally, open talks build trust, a key to great intimacy. Practically, set the mood with dim lights, no rush. One patient, 66 from Ohio, said sharing fears made oral sex more enjoyable than ever. Tip 7. When to seek professional help. If symptoms like dizziness or pain occur, stop and consult. Biologically, underlying issues might need adjustment. Emotionally, it's empowering to seek help. Practically, schedule a urologist visit. I offer telehealth for many states. To wrap up, gentlemen, oral sex can absolutely be part of a healthy life, even with high blood pressure, diabetes, or heart issues. By understanding your body, managing meds, and communicating, you'll enjoy the benefits, better mood, stronger bonds, and improved circulation, all backed by science. Here's a simple 4-week action plan. Week 1. Monitor your vitals and discuss with your doctor. Week 2. Try relaxed positions with hydration. Week 3. Incorporate communication tips. Week 4. Add protection if needed and track how you feel. Comment your progress below. Remember, this isn't a substitute for medical advice. If you have chronic conditions, always check with your healthcare provider first. Safety comes first. If you found this helpful, subscribe for more weekly tips on sexual health for men over 65, from testosterone boosts to STI prevention. Hit that bell icon. Comment which tip you'll try first, and share this with a friend who might need it. Age is just a number. With the right knowledge, you can thrive. Stay strong and take care, gentlemen.